Hello, my name is Stephen Wright. I'm Professor of Economics at Birkbeck College in the University of London. Like many people at present, I'm sitting here working from home. This is a short video that works through some of the basic mathematical and economic ideas that allow us to think about the COVID-19 virus. The central message of this video is that we will kill off COVID-19. But the big question is, will the process of killing off COVID-19 require billions of people to die? The simple answer to that is no, at least not necessarily. We can kill it off by social distancing policies. But that in turn requires us to ask, what economic costs are we prepared to pay to avoid billions of deaths? So you don't actually need very much mathematics to understand the key elements of the way a pandemic works. The key magnitude we're interested in when we study a pandemic is called its reproductive rate. So if we start by thinking about the number of active infections in some period of time t, we'll call that IT, then the key magnitude is the so-called reproductive rate of the epidemic, which we're going to call RT. And this has a really simple interpretation in numbers of human beings. It's the average number of people that each infected person infects over the course of the period that they are themselves infected. And we're going to make that length of time the length of the period t. And it turns out that this RT, the reproductive rate, is really quite easy to measure. You can do it in sophisticated ways or you can do it in simple ways, but in all cases you can measure it fairly straightforwardly simply by looking at the rate of growth of the number of active infections. So if we let the period of time, the time interval t, be a long enough time period for all new infections to happen, then we can simply measure R by looking at the ratio of the number of people infected in the next period, IT plus 1, to the number of people infected in this period, IT. Now, what the data suggest on COVID-19 is that the length of the time period could be as short as 5 days, maybe a little bit longer for the person to infect as many people as they're going to infect. And the evidence also suggests that in the early stages of COVID-19, when the population is unprotected, then the reproductive rate is around 2.5, i.e. the average person in the early stages of COVID-19 who catches the disease goes on to infect 2.5 other people. And this, of course, is averaging across the population. Now, RT is something we can actually just measure. So far, we haven't introduced any actual mathematical modelling into thinking about how a pandemic develops. But what we need to think about then is a model consists of how we think R behaves over time. Well, here's the very simplest possible model, and it turns out to be a very scary model, if we simply assume that R is constant over time. So it doesn't have a time subscript on it because we're just assuming it's always equal to, say, a number like 2.5. If that's the case, then in the next period, the number of infections will be equal to R times the number of infections in this period, IT. Roll that forward, the number of infections in 2 periods' time will be equal to R times the number of infections in 1 period time. But this equation here told us what that was, so if we substitute that, then we get that the number of infections in 2 periods' time is simply equal to R squared times IT, the number of infections today. Keeping on doing that process, rolling it forward repeatedly, we find that the number of infections in K periods' time is just equal to R to the power K times the number of infections today, IT. Now, if the mathematics of that looks pretty familiar, that's because it's exactly comparable with the standard compound growth model, which is often used in economics. So if we let R equal 1 plus G, where G is the growth rate, then these two are exactly equivalent. So we're looking at compound growth here at a constant rate. The difference here when we're talking about an epidemic is when we look at growth in economics, we're often looking at growth rates of 1, 2, 5%, relatively small numbers, and over an annual basis. Whereas here in an epidemic, we're looking at a growth rate of 150% when R equals 2.5. And this process is happening over a matter of days, not years. So if R is equal to 2.5, that says the number of infections actually doubles in less than 5 days. So this is our first model because we've actually made an assumption about the path R. We're simply holding it constant. So let's look at the implications of assuming that we simply have a constant rate R, constant reproductive rate, equal to that number 2.5. And we can quickly see that the implications are simply out of line with any realistic model of a pandemic. Because if R is constant equal to 2.5, then the epidemic just keeps on doubling in less than 5 days. And you can barely see the difference between the new infections, the brown line, and the blue line here, which is the cumulative infections. Essentially, within just a few months, if we continue to grow at that rate, then the virus would take over the entire population. And that's simply not plausible. Contrast that just as a benchmark for comparison with another assumption, with assuming constant R. What if we assumed that R was a number less than 1, say 0.95? And what that would mean that on average each person with COVID-19 would only infect slightly less than one other person. Now, you can rapidly see when you look at this case that this couldn't possibly be consistent with COVID-19 of having got to the stage it has got to already. Because starting from now, with R equal to 0.95, new infections would simply tail away because each person would infect slightly fewer people than the person before them. The virus, the cumulative infections would continue to grow, but to a number which would be a large number of infections, 10 million people, but globally speaking, that's a very, very small fraction of the global population. And contrast that with the chart on your left, it's a massively different outcome. But of course, if we actually were in this situation that the reproductive rate were as low as 0.95, we could never have got to where we are now with the epidemic exploding in the way that we're seeing. So let's make a modification to the model that turns out to give us something that is much closer to what we actually see in the data for real pandemics. And this is a model which has the concept of herd immunity. So in a situation like today, we can see that the reproductive rate R is currently extremely high. And the reason for that is that almost everyone in the population is currently vulnerable to COVID-19, because thus far a relatively small fraction of the population has actually caught COVID-19 in most countries. But if we think about a situation where that kind of growth continues, as it grows, each person could potentially infect 2.5 other people. But as the number of people in the population who've had the disease grows, the probability of infecting any given person begins to fall off. So here's a modified version of the model, which actually is a very simplified version of a quite standard model that is often used to model epidemics. We still maintain the assumption that the number of infections, current infections, grows at rate R, or that's the reproductive rate. But now we partition R into two components. The first element is called R0, which is the initial reproductive rate at the point where no one in the population is infected. So we call that R0, that's at time 0, and that's a number that is fixed. And we think that for COVID-19, that number is around 2.5. But we then have an extra term that determines RT, which is ST, the share of the population that is still susceptible. Now, if we consider a situation where, for example, we reach a point where half the population of the globe has already had COVID-19, and if we assume that, like most diseases at least, you can't get COVID-19 more than once, then whilst a person who has COVID-19 might potentially infect 2.5 people, if half the people in the world have had the disease, then only roughly half the people that he might potentially infect will actually get the disease. And so we might actually see an actual reproductive rate of only 1.25 rather than 2.5, because the remaining share of the population that is still susceptible simply determines for a randomly chosen infected person the probability that they will infect any other given person. If half the people in the population are susceptible to COVID-19, then that determines the probability of becoming infected by an infected person that you encounter. So let's now look at the implications of making this quite small change to the model of R. So here we have the profile of the two series that we looked at just now. Active cases per month at any point in time, and then the blue series is the cumulative total of cases in the globe. And in the early stage of this process, essentially where we are today, we have a situation where the number of susceptible people is very close to being the whole population. The proportion of people who have had COVID-19 is still small, so ST is still a number quite close to 1. In that situation then, the reproductive rate of the virus is very close to equal to R0, which is equal to 2.5. So in this early stage of the virus, you can hardly see the numbers here, but we're actually seeing extraordinarily rapid growth, but at still very small numbers. That's why you can hardly see it on the diagram. But we're seeing new infections doubling less than every 5 days. But before too long, and in just a matter of months if it carried on in this direction, you would actually see this explosive growth showing up in terms of not millions, but billions of infected people across the globe. And so the brown series would just be exploding upwards, and the accumulation of all these new infections would be growing even faster as the new infections are added to the stock of previously infected people. But the key point about the model of herd immunity is that this process doesn't go on indefinitely, because as this process happens, S begins to fall. And we reach a turning point in new infections when RT, which is equal, if you recall, to R0 times ST, is exactly equal to 1. At that point, ST must be equal to 1 over R0. So at that point there, if ST is equal to 1 over 2.5, the number we think is about the right number for R0 for COVID-19, then that's equal to 1 over 5 over 2, or 2/5 of the population. So what that says is we reach this turning point when 3/5 of the world's population has already caught COVID-19. So we're running into billions of numbers here. Beyond that point, as ST gets even smaller, then RT is less than 1, and we begin to look like the process that we saw earlier on, where R is less than 1, and the number of new infections decays away. But of course, it's still at a very, very large number, so the total number of people infected continues to grow until it reaches a point where almost everyone in the world actually would have caught COVID-19 by this point. So what are the implications of allowing the virus to run its course in this way? We kill it off, but we kill it off only because we acquire herd immunity. Well, look at the implications. We don't exactly know the implications, but we can get an order of magnitude. From the early estimates, we think that the mortality rate from COVID-19 is in the range of 0.5% to 1%, i.e. somewhere between 1 in 100 and 1 in 200 people who catch the disease die of the disease. And as we saw in the chart, if we rely on herd immunity alone, essentially almost everyone catches COVID-19. If we look at that in terms of the global population, that suggests that by the time it's all over, around 35 to 70 million people would die. Now, what should economists think about this? Well, it turns out that a pandemic is a classic externality. And it's a classic externality because there's a missing market. Suppose I have COVID-19. It costs me nothing just to do nothing about it, and therefore I run the risk of infecting you. But if I infect you, that's going to impose significant costs on you. It may even take your life if you happen to be an old person. Now that suggests that if you could get in contact with me and there was a market between the two of us, you would be prepared to pay me not to infect you. But in the absence of such markets, I will not respond to the signal that should be given to me, and I will simply go out and infect people. So in that respect, a pandemic is a classic externality, and therefore an economist would say we definitely cannot rely on simply leaving a pandemic to run its course, because it will have significant economic as well as human costs. And actually this is reflected in the way governments behave. Governments actually, in thinking about health more generally, but in particular in the context of pandemics, actually are willing to spend money to save lives. But governments have limited resources, so they have to make up their mind how much they would be prepared to spend to save a given number of lives. And of course, one could have big debates about exactly how much governments should be prepared to spend. But actually, one thing that's helpful in this context is we can actually draw on what governments already do. Because governments have to make this kind of decision all the time. Governments are continually faced with choices about whether to spend money which may save lives, and so they have to put a financial value on how much a life actually is worth. And so if we want to think about the costs of herd immunity in economic terms, we can use those numbers to give us an estimate of how much governments might be prepared to spend to save those kinds of numbers of lives under normal circumstances. And here's a very crude calculation based on data for the United Kingdom. In the UK, our National Health Service has a number that it uses at any point in time to try and assess how much money it should spend to save lives. And at present, the sort of amount of money it would spend would be of the order of £20,000 to £30,000 to save what it calls a single quality adjusted life year, or QALY. And that just reflects the idea that if you're thinking of saving lives, you have to think about how long the person you're going to save the life of is actually likely to live, and also you have to think about the quality of life that person will have. So, for example, if you were a 20-year-old with 50 or 60 years life left to live, the NHS in Britain will be prepared to spend a lot more to save your life, roughly speaking, £1 million to £1.5 million to spend the life of someone who's around 20, than if you were, say, 80 years old, which might mean you only had 5 to 10 quality adjusted life years left, which means the NHS would spend maybe as little as £100,000 to try and save your life. So these numbers sound brutal, but this is the sort of calculation any health service in the world has to make all the time. So what do those kind of numbers imply if we start thinking about the implications of acquiring herd immunity in the UK? The UK population is around 67 million people, and the best estimates that we have of around mortality rates of something like 0.5% to 1% suggest that achieving herd immunity in the UK would cost between around 300,000 to up to 700,000 pounds, 7,000 lives in the UK. And those would mostly, of course, be elderly people. Indeed, here's some numbers from Professor David Spiegelhalter of Cambridge University that shows that the mortality rate from COVID-19, as estimated by statisticians at Imperial College, these are the solid dots here, and you can see that the mortality rate, if you catch COVID-19, rises very steeply with age, because these are probabilities here on a log scale. So these are, each time you move up one of these axis points, you're doubling the probability of catching the disease. And what Spiegelhalter showed was actually the risk of dying if you catch COVID-19 is actually almost exactly equal to your risk of dying over the course of the next year. So for people who are in their 20s or 30s, the risk of dying over the course of the next year is extremely small. But once you get to the age of 80 or 90, your risk of dying over the course of the next year is very much higher. So what Spiegelhalter was saying is that actually, if all of the deaths from COVID-19 were to occur in the kind of short period we've seen in the case of herd immunity, we'd essentially be bringing forward all the deaths in the UK in a single year into a matter of 2 or 3 weeks. So what would be the cost of doing that, or how would the NHS, how much would the NHS be prepared to spend at least to avoid that on its normal rules? Well, let's say that each of those deaths would cost around 15 quality-adjusted life years for someone in their 70s, roughly speaking. And let's assume a midpoint estimate of £25,000 per quality-adjusted life years. On the usual rules of what the NHS would spend, that would imply it would be prepared to spend, or the British government will be prepared to spend anything from 125 billion up to around 250 billion pounds, which in terms of units of GDP is between 6 and 11% of GDP, to prevent those deaths. Now, of course, it's a big stretch to say that they will be prepared to spend that much to prevent that many deaths, because these kind of calculations are typically done just for a single death or a small number of deaths. And the other key point that Professor Spiegelhalter pointed out in relation to this chart is that bringing forward a year's worth of deaths into a short period of just a matter of weeks would put extraordinary strains on the National Health Service. And indeed that point was also made by the Imperial College statisticians, which actually seems to have been one of the things that persuaded the British government to change its approach to dealing with COVID-19. Now, in practice, no modern government simply leaves pandemics to run their course in the way we've just been describing. All around the world, we're seeing at the moment governments are attempting to control the growth of the pandemic by introducing what are called social distancing measures that are essentially attempts to try and reduce the reproductive rate of the virus. And we can capture this in a very simple, stylized way in our model by simply thinking about the impact of governments attempting to keep people apart from each other. So we introduce a new parameter to our model, DT, which captures the minimum distance that governments try and impose between infected and uninfected people. And we can think of this as being measured in meters, if you like, but they're purely notional meters, i.e. the larger the value of D, the harder we are working to keep infected people away from uninfected people. So a higher value of D in notional meters reduces the number of people each person infects, and thus, in so doing, reduces the probability of their passing the infection on to any other given person, and that in turn reduces the reproductive rate, RT. So we've modified our model here where you can see, I hope you can see, that if D was 0, i.e. we're allowing people to kiss and shake hands, then we would be back in the world of our simple model that we had previously, where the only determinants of RT were R0 and ST, the share of susceptible people in the population. But as we increase D, then this effectively reduces the probability of passing the infection on to any given person. A larger value of D directly reduces the reproductive rate. So really we can think of these distancing measures as essentially attempts to control the reproductive rate. But by doing so, taking into account that two other aspects of the reproductive rate, R0 is just a characteristic of the virus, and ST is simply given by where we stand in history today, the proportion of susceptible people. So we need to find some way of bearing down on the reproductive rate of the virus, and we're capturing this by this parameter DT. So now let's see what introducing these distancing policies does to the path of the virus. Here's an example where we have relatively limited social distancing. So remember that we're only measuring distance in a purely notional sense, but we'll call this d equal to 1 metre. So people are being kept apart from each other, but not perfectly apart from each other. Here's an example of someone not perhaps keeping as close, as far apart from other people as he should have done, and you may be aware of the consequences of that. The Prime Minister of the UK, Boris Johnson, is now in self-isolation, having caught COVID-19, and he was not obeying the 2-metre rule that had been imposed by the British government during this press conference. So, what's changed where we introduced this limited degree of social distancing? Well, you can see that we still have a hump-shaped pattern in active cases. But a key point, and this has been a very crucial point about social distancing, that this delays the peak. So now, instead of the peak in the virus occurring in a matter of 1 or 2 months' time, we're pushing this well in towards the end of the year, a matter of 8 or 9 months. Please don't take these numbers in absolutely literally, but we're clearly delaying the onset of the virus non-trivially. As a result, but the other key point is, it's not just that the peak is delayed, it's also a lower peak. At the peak, far fewer people are being infected, and that in turn means that fewer people across the globe are affected, assuming this kind of distancing policy was carried out across the globe. But we still have a turning point. Now, however, we have a turning point where the reproductive rate is again equal to 1, but we now have an additional term in determining this turning point. If this expression RT is equal to 1, then we can see that that happens when ST, the proportion of susceptible people in the population, now that happens when it's equal to 1 plus D over R0. And if we plug in that particular value of D, that notional 1 metre, then you can see that that adds an extra term to the denominator here, to the numerator here, and that in turn implies that we get the peak when ST is 4/5 of the population, i.e. that's when only, in inverted commas, 1/5 of the world population has already caught COVID-19. But of course that's still a number going into billions. And the other aspect of this is that from this point onwards, the virus decays away more slowly, the active infections decay away more slowly, which means that the accumulation of these cases continues to grow to non-trivial extent. So you still end up with just under 3 billion people being infected in this particular case. So what happens if we push a little harder on social distancing and we raise D to a notional distance of 1.4 metres apart? People never get closer than that to each other. Well, this really delays the peak of the virus, spreads it out till the peak is barely visible in the chart here, and that occurs around 2 years from now. But then it decays away extremely slowly. And we still get a significant number of infections, but we're now keeping the total number of infections below 1 billion people. Why is this happening? Well, even when we push D up to 1.4, at the initial values, when ST is approximately equal to 1, around now, then RT is still equal to a number greater than 1 when you do the sums. And so for a long time, our number of infections continues to grow and only tails off at this turning point after around 2 years. But what if we work collectively even harder at social distancing? Well, now I look at the case where we push D up to 1.6, seemingly a relatively small change, but you can see that the impact in the diagram is really quite dramatic. With D of 1.6 notional metres, infections actually decay away. And the reason for that is that with that particular value of D, RT is actually pushed below 1 when you do the calculations from current values, which means if we could achieve this kind of value across the globe, we would actually be able to see a path where infections were starting to decay away. But that, of course, requires strong social distancing. Now, of course, active infections would still be a positive number, so the number of people infected would continue to grow for quite some time, for at least a year more, but we'd be looking at infections across the globe only running into maybe 10 millions or so. Again, please don't take these numbers as being precise forecasts. We're just trying to get a feel of the impact of this. So you can see this is a dramatically different picture compared to the only modest values of D that we saw in the previous experiments, where herd immunity still plays a very, very important role. In this case, if we can push social distancing up to a strong enough extent, we do not need herd immunity to pull COVID-19 back down towards zero. And I should stress that this isn't a purely abstract idea. We've already seen that a number of countries, most notably China, but also it seems South Korea, have managed to see a steadily declining path in infections from COVID-19 due to very strong distancing policies. So this is not just an abstract concept, it's absolutely a viable proposition, it seems, from what we see in the data. And we can summarise the contrast between these different cases I've just looked at by comparing the cumulative total number of infections for different values of my notional social distancing measure in purely notional meters. What you can see is that if people are stay very, very close to each other, essentially no attempt at social distancing, then essentially pretty much everyone in the globe, 97% of the population, ends up being infected. But as we increase the notional distance that people stay apart from each other, progressively smaller proportions of the globe become infected. So at D equals 1, we're only infecting roughly 40% of the globe in the end. But we can see there's a really very striking dividing point on this diagram. There's a massive change in the slope of this relationship at around D equals 1.5. Now, there's nothing particularly special about that D equals 1.5, except for the crucial point that at D equals 1.5, for an initial value of almost everyone in the population susceptible, then at that particular value of D equal 1.5, then RT is actually exactly equal to 1. And for any value of ST less than 1, then RT is less than 1, which means we can actually get a declining path for infections. And that then gives you this extremely marked change in slope of the relationship between social distancing and total deaths. And it should be stressed that beyond this point here, as we move along the line here, this is not that cumulative infections are zero. They are just a very, very small proportion of the global population because we've managed, if we achieve that strong social distancing, we can push R below 1 and push total infections down on a progressively declining path. So we can see that the crucial thing is not actually the particular value of D, because we don't really know how far apart we need to stand. It's, can we get the value of social distancing up to a sufficiently high value that the reproductive rate of the virus is pushed down to 1 or less than 1. Now that might lead you to one conclusion, which is to say, remembering that the reproductive rate for the virus can be interpreted simply as how many people does the typical person in the population infect. That could lead you to the implication that what we should simply do is say, let's try and ensure that each infected person only infects one other person during the course of the infection. No more, but it doesn't in principle have to be much less, because if we can only achieve that and know that we can achieve that, we could push the virus down onto a declining path. But I think there's a very clear-cut answer that this cannot be a target policy, because whilst in our model we know the clear-cut relationship between social distancing captured by our parameter D and the reproductive rate of the virus, in practice, in implementing these policies, we simply do not know how well social distancing policies will work. So if all we do is target a degree of social distancing that just is targeted to try and get R to a value of 1, the risk of getting it wrong, if we don't quite push people far enough apart, means that significant fractions of the global population, running into billions, could quite easily still be infected by the virus, with consequently very, very large numbers of deaths. So the risk of getting it wrong is just too strong for us to be targeting a value of R around 1. We have to be targeting a number very much less than that. Indeed, the simplest target is simply that we should try and infect nobody if a person is infected. So if we look around the world at the moment, we can see that throughout the world, governments are clearly taking social distancing very seriously indeed. And we can see that China has already succeeded through social distancing policies carried out a month or so ago in reducing new cases of COVID-19 to extremely low levels. And it's worth stressing it has done this without herd immunity, i.e. the proportion of people who have caught COVID-19 in China still appears on the published data to be really very low indeed. There are only 56 cases per million people in China as of 23rd of March. Looking around the world, however, in other countries, we can see that the social distancing policies that have only been put in place much more recently, we've yet to see whether these are going to achieve the same kind of gains. But we also have to acknowledge that these social distancing policies have had extremely large impacts on the global economy, with very large fractions of people not being able to carry out their usual jobs, and so very substantial falls in output. And I think we need to bear in mind why these costs are so substantial. This reflects actually a very serious, acute informational problem with COVID-19. The analysis we've just been doing is actually about the idea of trying to stop any given infected person infecting another person. So we would like R to be brought down for infected people. So in an ideal world, if we knew who the infected people were, we would apply social distancing policies only to those infected people. But in the absence of the knowledge of who the infected people are, we're applying it to whole populations, despite the fact that the number of people we in principle should apply it to if we only had information would probably be less than 1% of the population in almost all countries. And this means that the shadow price in economic terms of getting a cheap test and implementing it widely and managing to identify the people who actually have the virus is extremely high. And that's why we can see such efforts being made to roll out quick and cheap tests throughout the world. So just to conclude, as I said at the outset, we will kill off COVID-19 eventually. The key issue, the only real issue, is how many people get killed in the process. And what the simulations I showed you show is that if we rely on herd immunity to kill off COVID-19, it's going to have very, very high costs, both in human and financial terms, because as human beings, we have to put a financial value on those lives lost. We can also see from looking around the world that killing off COVID-19 via social distancing can be extremely effective and doesn't rely on those immense costs that you can only achieve through herd immunity. But the key point of the mathematics is that we can only do that, we can only achieve that if we can push that reproductive rate of the virus, RT, below 1, i.e. each infected person must on average affect less than one new person, in which case the disease begins to decay away. And this isn't just an abstract concept, this has actually been achieved in several countries. But in thinking about this possibility of using social distancing, we also have to acknowledge the extremely high costs associated with social distancing because it's such a blunt instrument. It's an instrument that we would like to apply only to infected people, but in the absence of full information, we have to apply it to entire populations with really very significant economic costs. If you want to experiment with changing the parameters of the problem and different scenarios, then there's an Excel spreadsheet that goes with this video that you can find on the core website. And I'd encourage you to change some of the parameters and see the implications on the outcomes.